Welcome to our webinar on mammography and Modifier GG. My name is Jennifer Boniface, and I am one of the nurse analysts from the Provider Outreach and Education team. Today's webinar will focus on Medicare requirements for mammography, including the use of Modifier GG. Before we get started with the webinar, I want to take a moment to let you know that we really want your feedback. It helps us deliver the education on topics that may be of interest to you. Consider taking our survey to let CMS know what you did like and what topics you want to learn more about. And Aline will place a link to the survey in the chat. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while watching the encore presentation. To access the survey, click on the circle with the eye in the upper right corner of the video. A link to the survey is also found in the description of the video. On this slide, we have our disclaimer. It states that this education is for informational purposes only. Medicare rules do change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations. These do take precedence over anything that we present today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on our training center page under Encore Presentations, as well as on our YouTube channel under Encore Presentations. On this slide, we have the CPT copyright notice. This is a requirement to be provided to you since we have CPT codes within the presentation. Please review this information at your convenience. On this slide, you will see a list of several different acronyms used during this presentation. While you may already be familiar with many of them, feel free to refer to this slide for clarification if you encounter any new ones. Mammography is an essential diagnostic tool for breast cancer screening and diagnosis, providing crucial information that can assist in early detection and treatment. The American Cancer Society reports when breast cancer is identified early and is in the localized stage, the 5-year relative survival rate is 99%. Mammography facilitates early detection, which allows healthcare providers to address breast cancer at an earlier stage and potentially improve a person's chance of survival. Although mammography plays a significant role in clinical care, the billing processes associated with it can often be confusing. Today's webinar will provide the necessary information needed to understand both types of mammography and when to use Modifier GG. During today's webinar, we will review the two main types of mammography performed, Medicare coverage criteria for screening and diagnostic mammography, proper use of Modifier GG when billing mammography, and guidance for documenting screening and diagnostic mammography. We're going to first start with an overview of mammography. Mammography is a diagnostic imaging procedure designed to examine breast tissue for irregularities. It uses X-ray technology to capture images of the breast, which can help identify problems like lumps, cysts, or calcifications that may suggest breast cancer or other issues. There are two main types of mammography, screening and diagnostic. Screening mammography is performed on women who do not display any signs or symptoms of breast cancer to help detect early indications of the disease that might not be noticeable through routine examination by the healthcare provider or the patient. It can also be utilized to further examine any abnormalities found during a clinical breast exam, allowing for timely diagnosis and treatment. The screening mammography includes a physician's interpretation of the procedure's results. This procedure uses low-dose X-rays to generate detailed images of the breast, typically capturing views from at least two angles, specifically craniocaudal and mediolateral oblique for each breast. Any changes in the breast will appear within those images. There are several types of breast changes that can be detected through screening mammography. The first type is calcifications, which include macrocalcifications and microcalcifications. Calcifications show up as white spots on the mammogram. Macrocalcifications are typically linked to non-cancerous conditions and usually do not necessitate further testing. Most microcalcifications do not require biopsy. However, if microcalcifications display suspicious features or patterns, a biopsy may be recommended for further investigation of potential cancer. Next, we have masses, which include cysts and solid tumors. Third type is asymmetry, followed by distortion in one or both breasts. Finally, changes in breast density may also be observed. Although screening mammography can identify abnormalities in the breast, they cannot determine whether these abnormalities are cancerous or not. If a screening mammogram reveals any unusual findings, additional tests may be conducted to confirm whether breast cancer is present. Typically, this begins with conducting a diagnostic mammogram. A diagnostic mammogram provides a detailed image and examination of the entire breast to evaluate any abnormalities detected in the screening mammogram. This includes abnormal findings such as a palpable lump, persistent localized pain or tenderness, changes in the skin or nipple, or unusual nipple discharge. It may also be used to evaluate the breast when a woman exhibits signs or symptoms that could indicate possible breast cancer. A physician's interpretation of the procedure is also included with diagnostic mammography. Diagnostic mammography offers additional images of the breast that are usually not part of routine screening mammograms. After completing the diagnostic mammogram, if the provider identifies any suspicious areas that may indicate breast cancer, additional diagnostic tests may be performed to further assess the abnormalities found. Additional diagnostic tests may include, but are not limited to, breast ultrasound to further evaluate any detected lumps or to visualize areas of the breast that may be challenging to see on a mammogram. Breast MRI to evaluate symptoms that could suggest breast cancer, determine the size and location of any tumors, and detect any additional growths. And breast biopsies to obtain a tissue sample for analyzing for potential cancerous cells. Next, let's discover the Medicare coverage criteria for mammography. Medicare Part B provides coverage for screening mammography for female beneficiaries aged 35 and older. This includes one baseline screening mammography for women between ages 35 and 39, and annual screening mammography for women aged 40 and over. Please remember that at least 11 months must have lapsed since the last Medicare covered screening mammogram for Medicare to cover the service again. To calculate the 11-month period, start by counting from the month after the previous screening mammography. It's important to note that Medicare covers screening mammography only for female beneficiaries and does not provide coverage for male beneficiaries. There is no copayment, coinsurance, or deductible if the healthcare provider accepts assignment. According to Medicare Benefit Policy Chapter 15, Section 280.3, a doctor's prescription or referral is not necessary for the coverage of screening mammography. Per National Coverage Determination NCD 220.4 mammograms, Medicare will cover the cost of diagnostic mammography if the patient meets one of the following conditions: has distinct signs or symptoms for which a mammogram is indicated, has a history of breast cancer, or is asymptomatic, but based on the patient's history and other factors the physician considers significant, the physician's judgment is a mammogram is appropriate. Medicare may cover diagnostic mammograms more than once a year if they are considered medically necessary. Unlike screening mammography, Medicare covers diagnostic mammography for both female and male beneficiaries, provided they meet one of the qualifying conditions we just discussed. For a diagnostic mammogram, once the Part B deductible is satisfied, the patient is responsible for paying 20% of the Medicare approved amount. According to NCD 220.4, a diagnostic mammogram requires an order from a doctor of medicine or osteopathy to be covered. Before we proceed, let's review the HIC, PICS, and CPT codes used when billing mammography. Mammography should be used billing one of the following codes: 77063, screening digital breast tomosynthesis bilateral, listed separately in addition to the code for the primary procedure. Use 77063 as an add-on code to 70067 when tomosynthesis is used in addition to 2D mammography. 77065, diagnostic mammography, including computer-aided detection when performed unilateral. 77066, diagnostic mammography, including computer-aided detection when performed bilateral. 77067, screening mammography, bilateral, two-view study of each breast, including computer-aided detection when performed. And G0279, diagnostic digital breast tomosynthesis, unilateral or bilateral, this separately in addition to code for primary procedure. So now let's discuss Modifier GG. Modifier GG should be used when a diagnostic mammography is conducted on the same patient on the same day as a screening mammography. It should not be used when the mammograms are performed on different days or if the mammogram is conducted for quality checks or due to a system failure. Attaching a modifier GG to the diagnostic mammography code indicates that the screening mammography converted to a diagnostic procedure. CMS instructions require providers to report and submit the GG modifier with the diagnostic mammography CPT codes 77065 and 77066. 77065 is diagnostic mammography, including computer-aided detection when performed unilateral, and 77066 is diagnostic mammography, including computer-aided detection when performed bilateral. The GG modifier must be appended to the claim line with the CPT code, procedure code for the diagnostic mammogram. However, since modifier GG is not recognized as an NCCI associated modifier and will not override the NCCI edits, providers are advised to also use breast imaging modifier 59, distinct procedural surface, with the screening mammography codes CPT 77067 to bypass the NCCI edits. Modifier 59 indicates that a procedure is separate and distinct from another procedure performed on the same date of service. To qualify for reimbursement, the diagnostic mammogram must include modifier GG, and the screening mammogram must also have modifier 59 appended. Without modifier 59, the screening mammogram will not be eligible for reimbursement. Finally, we will conclude with some tips to assist with ensuring proper documentation for mammography services. Documentation for screening mammography should include date service was provided, documentation of any follow-up care or counseling that was given following the procedure, and test results and documentation of any follow-up care or counseling that was given following evaluation of results. Documentation for diagnostic mammography should include date service was provided, signed and dated doctor of medicine or osteopathy order for the diagnostic mammogram, documentation to support medical necessity of the diagnostic mammogram, documentation of any follow-up care or counseling that was given following the procedure, and test results and documentation of any follow-up care or counseling that was given following evaluation of results. Include the patient's name and date of service on all documentation. When billing the mammography services, be sure to include all documentation necessary to support the billing on the claim, including but not limited to provider notes, mammography results, and any follow-up care as applicable. Lastly, ensure all documentation is clear and legible and is authenticated. All entries should be signed and dated and should be timely. Include legible signatures and credentials of professionals providing services. A signature log or a signature attestation statement should be sent with confirmation of the signature if the signature present is illegible. If electronic signatures are used, include the electronic signature policy detailing the process of signing and dating notes and orders. The provider cannot use stamped signatures except in special circumstances. CMS allows stamped signatures if providers have a physical disability and can prove that a CMS contractor that they are unable to sign due to a disability. For more information regarding signature requirements, please refer to CMS's fact sheet MLN 903364, complying with Medicare signature requirements. A link to this has been added to the resources slide at the end of the presentation. Mammography is a vital diagnostic tool for breast cancer screening and diagnosis, delivering critical information that supports early detection and treatment. Accurate documentation of mammography services is essential for delivering optimal care to the patient and for ensuring accurate billing and reimbursement for the services rendered. So as a recap, during today's webinar, we discussed two main types of mammography performed, explained the Medicare coverage criteria for screening and diagnostic mammography, reviewed the proper use of Modifier GG when billing mammography, and provided guidance for documenting screening and diagnostic mammography. And I've included some links from the CMS website on this slide. These links were mentioned during today's presentation. Please refer to the slide and use it as a reference when reviewing the presentation. Finally, CMS has issued Change Request 13754 titled Disable Beneficiary Eligibility Information for Mac IVR Systems. Currently, users can still access beneficiary eligibility information. However, eligibility will be removed from the IVR on January 1st, 2025. This initiative is part of CMS's ongoing commitment to safeguard beneficiaries against Medicare fraud. The change is part of a pilot program involving most MACs, and CMS will assess its impact to determine whether the eligibility function will be restored or permanently removed. We have included additional eligibility resources on this slide to assist providers with checking eligibility. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions into the chat feature and select Send to all panelists. If you don't get your question today during the presentation, we will send out a document to all participants with the answers following this webinar. We did receive two pre-submitted questions I'd like to address before we go to questions in the chat. Question 1 asked what to do if a provider bills a screening mammogram CPT with a diagnosis. If a provider submits a billing for a screening mammogram using a diagnostic diagnosis code, this is considered improper practice and should be corrected. The diagnosis code should be removed and replaced with the appropriate Z code for the screening encounter, such as Z12.31 for breast cancer screening. This is because a screening mammogram is performed on an asymptomatic patient and should not be associated with a specific disease diagnosis. Contact the provider to request that they amend the claim using the proper diagnostic CPT and diagnosis codes that accurately reflect the reason for the mammogram. Billing a screening mammogram with a diagnostic diagnosis may raise concerns about the procedure's medical necessity. Question 2 asks which diagnosis code is used on the claim if the abnormality is found during a routine screening mammogram. Providers should use ICD-10 code Z12.31 and counter for screening mammogram for malignant neoplasm of the breast when reporting the primary diagnosis code for screening mammograms. This code is used specifically when a mammogram is done for screening purposes and is not intended for a diagnostic mammogram or for a patient with known symptoms or findings of breast cancer. Even if the results of the screening mammogram show a positive finding, such as a suspicious lesion, Z12.31 should still be used as the primary code for the screening purposes. This is because the primary intent of the encounter was to perform a screening, not a diagnostic evaluation, and the mammogram was performed as part of a routine preventive care. If there are any abnormalities found, the provider would need to report additional codes to describe the specific findings. These additional codes are used to reflect the clinical findings or abnormal results. The Z12.31 code should be placed in the principal diagnosis code area if the screening mammography is the only service reported on the claim, while the additional diagnosis codes reflecting any findings or conditions would be reported separately. If the claim contains other services in addition to the screening mammography, Z12.31 is reported as appropriate in other diagnostic codes. Additional informational coding for mammography can be found in Medicare Claims Processing Manual, Chapter 18, Section 20.2, and a link to that resource will be placed in the slide. So I'm now going to ask if we have any questions in the chat.
Jennifer, thank you. We did have one question, and it was regarding the diagnosis code, so you answered that one. The other question that we have is from Lisa. She says, we are having trouble billing a diagnostic mammogram with the breast ultrasound on the same day. We have tried the Modifier 50, but the claims deny as duplicate. What is the best way to bill those two services on the same day?
For that one, the provider would need to choose a principal diagnosis code based on the patient's condition. Additionally, the ICD code Z12.31 should be reported in other diagnostic fields. There is some clarification in the Internet-only manual, publication 100-04, Chapter 18, Section 20.2 for more information. I'm not quite sure if that's going to help her or not. Does she have any more clarification on that?
Lisa, if that doesn't answer your question, we can look into it further and provide some research and get back to you. And Jennifer, that is the only question that was in chat.
And again, thank you, Lisa. Again, if you do want a little more clarification, oh, I can see she said that would be great. So I will get a little more clarification for you, and I will send that out to everyone so everyone has a good clarification on that. On behalf of myself, Medical Review, and all of Provider Outreach and Education, thank you for attending today's webinar on Modifier Monday, Mammography, and Modifier GG. As a reminder, this presentation will be posted as an encore presentation on the Training Center page of our website. Please take our survey with the link provided. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.